intermediate common. So where the coronaries perfuse is important to know, and we have an AHA standardized model for this, where we know the LAD supplies the anterior and anteroseptal territories, and the RCA is going to supply the infraseptal and inferior wall, and then the lateral wall is mostly going to be circ. However, there is a slight variation that can be individualized. And then this is just an example on how, with knowing where the coronary branching course is, in this particular individual, there's a slight variation here in the apex where it comes. So there's a slight variation, and there's also some territories that can be supplied. So that's also important to know. There are some territories that are only supplied by a single vessel, and that's where, when we have obstructive disease, we get in trouble. So we talked about normal patterns, and then for the anomalies, they're going to be categorized into two main things. One, the things that exist, but they're not going to be clinically significant, such as benign anomalies, and then the malignant. So we'll start with the sort of benign single coronary artery, where there is just one coronary artery bed supplying the whole heart. Benign origin of a coronary can happen when a coronary is coming from the opposite sinus. However, this thing is very important to know, that the course matters. So even if the left coronary artery arises from the right sinus of Valsalva and it has an intra-arterial course, if it courses below the pulmonary valve plane, then this is considered to be a benign anomaly. This obviously comes in, there are caveats, and it depends. It's not a stamp, right? So it's not like it courses below and then you're done and the patient's fine. Depends on the reason why they're referred for this test in the first place, if they're having symptoms, et cetera. Sometimes we require confirmation of these anatomical planes, clinical significance with a functional stress test. So same thing for the right, it can arise from the left sinus of Valsalva. And then the effusins, if anyone knows a better pronunciation for these, arterial ring. By the way, that name is, it's important in the history of the anatomic information that we have about coronary arteries and veins. But that arterial ring basically when it's present, it can supply a collateral form of circulation between the right side and the left side of the coronary. So it can be a bystander, and it then just exists. And then for some cases and people that have obstructive disease of one of the other coronary arteries, it can actually be a lifesaver by connecting some of the circulation in a retrograde fashion. Moving on to malignant anomalies. So coronaries that are coming from the opposite sinus, ACAOS, so pathological variant, when they course between the aorta and pulmonary artery superior or crossing through the pulmonary valve plane. A coronary fistula, it's an abnormal connection between the coronary artery and a cardiac chamber or great vessel. So they drain into one vessel. Now, you can think of the coronary arteries into three main categories, and that's going to be where the origin is anomalous, or the course is anomalous, or the ending or the drainage. So that's the coronary fistula. And then we saw earlier an example of R kappa. So here's just I'm naming the L kappa, which is the BWG, anomalous origin of the left coronary artery from the pulmonary artery. So that's the left, the L kappa. And so here's just a schematic picture of so this is going to be your L kappa. So the left coronary is coming from the pulmonary artery. Here's an anomalous origin from the opposite aortic sinus. So the left and the LAD, the circ and the LAD are coming from the right coronary cusp. Congenital atresia of the left main is where the arteries are going to be filling from basically the distal right-sided, and the left main is truncated, and usually you'll see a stump. So it's basically not formed well, not well formed left main. And then we also talked amazing lecture about myocardial bridging, which we now know the definition for, coronary aneurysms, and then coronary fistula. And as I was mentioning here with this venous artery, now that I'm talking about coronary aneurysms, that's one of the potential things that could happen with a very small vessel and potentially high pressure there. That could be risk factor or for formation of a coronary aneurysm, for example. And then fistulas, where we are draining into a cavity.